Most seniors don't realize their shower is the most dangerous spot in their entire home. As a doctor, I see this all the time. Patients who are otherwise healthy end up with sprains, fractures, and even head injuries simply because of small hazards hiding inside their bathroom. The shower becomes more risky with age because balance begins to change, reflexes slow down, and the body doesn't respond as quickly when a foot slips or the floor becomes unstable. Even strong individuals start to notice weaker joints, reduced mobility, and a slight delay when shifting weight, and that delay is often the difference between catching yourself and ending up on the ground. The biggest issue is how normal everything looks. Wet tiles don't seem dangerous until you step on them at just the wrong angle. Sudden temperature changes can cause dizziness or light-headedness. Hard surfaces like tile walls or the edge of the tub create a dangerous impact zone during a fall. Poor lighting makes depth perception worse, especially for anyone with vision changes. And one of the most overlooked hazards is unstable grip points, like towel bars or loose handles that people rely on for support, but aren't designed to hold body weight. This video is going to break down every hidden danger doctors warn seniors to watch for and the simple doctor-approved steps you can take to make your shower safer, easier, and far more supportive. Whether you're trying to protect yourself, a parent, or a grandparent, understanding these risks can prevent serious injuries and give you peace of mind. If you're looking for practical advice backed by real medical experience, you're in the right place. This is your complete guide to senior shower safety, preventing bathroom accidents, and creating a safer routine that keeps you confident and independent. Do you know someone who has slipped in the shower before? Comment why yes or no when doctors warn seniors about hidden shower dangers. Most people think they're exaggerating, but the truth is that the bathroom is one of the most common places where serious injuries occur. The reasons aren't dramatic or complicated. They're small, everyday hazards most people don't even notice. Wet floors, soap residue, and slippery surfaces might seem harmless when you're younger, but as balance changes and reflexes slow with age, these tiny details turn into major fall risks. Even a thin film of water on tile can remove almost all friction under the foot, and when soap residue mixes with water, the surface becomes even more unstable. Seniors often underestimate how easily a foot can slide when the floor looks perfectly clean, but still has a slick coating left behind from shampoo, conditioner, or body wash. Another danger many people ignore is the moment you step out of the shower or tub. The transition from a wet surface to smooth tile multiplies the chance of slipping. When you step onto tile that's already slightly damp, your foot loses traction instantly. Even strong individuals can find themselves sliding before they have time to react, and for seniors who already deal with slower reflexes or weaker joints, this moment is one of the most hazardous parts of the entire shower routine. The problem becomes worse when the bathroom mat doesn't grip the floor properly, or when it folds under pressure as someone steps on it. Hard surfaces inside the shower add another layer of risk. A fall in a carpeted room might result in a bruise, but a fall in the bathroom means hitting tile walls, metal faucets, soap holders, or the edge of the tub. These surfaces don't absorb impact, they amplify it. Seniors are far more vulnerable to fractures, head injuries, and joint damage from even minor impacts. Something as simple as reaching for a wall to steady yourself can turn into a serious injury if your hand slips or the wall is too slick from humidity and moisture. These are the types of unseen shower dangers that lead to hospital visits and long recovery periods that could have been prevented. Temperature changes are another hidden hazard that most seniors never think about. When hot water hits the skin, blood vessels dilate, which can drop blood pressure suddenly. This sudden change can cause dizziness, unsteadiness, or even fainting. The opposite can happen when cold water hits unexpectedly. Your body tenses, breathing changes, and balance becomes unstable for a moment. For younger people, this shift goes unnoticed, but for seniors, temperature shocks during a shower can create a brief but dangerous window where a fall is far more likely. If you combine that with slippery floors or poor footing, it becomes a perfect setup for an accident. Temperature regulation problems become more common with age, and many people don't realize that a simple change in water pressure can trigger these reactions. Poor lighting contributes quietly to the problem. When the shower isn't well lit, depth perception decreases. Shadows make it harder to see water on the floor or judge distances correctly. Seniors with vision changes, cataracts, or light sensitivity may struggle even more. A misstep that wouldn't matter in a bright room becomes a serious danger in dim lighting. The bathroom is often the last place people think about upgrading their lighting, but it's one of the most important spaces for preventing senior injuries. One of the biggest unseen dangers is relying on unstable or improper support. Many seniors instinctively grab towel bars, soap shelves, or the edge of the shower door when they feel off balance. The problem is that none of these structures are designed to hold body weight. A towel bar can rip out of the wall, a shower door can shift under pressure, and a shelf can snap without warning. When that happens, the person not only falls but falls with additional force because the object they grabbed collapses at the same time. This is one of the most preventable bathroom fall risks, but also one of the most common. Seniors assume these fixtures are strong enough, but they aren't built for support. Another overlooked factor is the combination of humidity and limited ventilation. Steam settles on the floor, walls, and fixtures, making everything more slippery than it appears. For seniors who already experience mild vertigo or breathing changes in humid environments, the shower can become disorienting quickly. The sensation of heat, steam, and slippery surfaces creates an environment where one small misstep can lead to a serious injury. All of these bathroom fall risks add up to one clear reality. The shower contains multiple unseen shower dangers that most seniors never recognize until it's too late. By understanding how these hazards work, you can take simple steps to create a safer environment and significantly reduce the chances of a preventable injury, giving seniors confidence and independence in their daily routine. When we talk about shower safety for seniors, it's important to understand that aging changes the way the body moves, reacts, and recovers. These changes happen slowly over time, but they have a direct impact on how safe or unsafe the shower environment becomes. One of the biggest factors is balance decline. As we age, the inner ear, muscles, and nerves responsible for maintaining stability don't communicate as quickly as they used to. Seniors have a harder time making quick adjustments when the floor becomes slippery or when their weight shifts suddenly. What used to be a fast, automatic reaction, like catching yourself when your foot slips, becomes slower and less coordinated. This delay may only be a fraction of a second, but in the shower, that tiny delay can be the difference between staying upright and falling. Reflexes also slow down with age. The nervous system doesn't send signals as rapidly, and muscle response time decreases. This means seniors can't correct their balance as quickly when something unexpected happens, such as stepping on a slick spot or turning too fast. With water, soap, and steam involved, the situation becomes even riskier. A younger person might slip slightly and immediately recover, but seniors often don't have the same reaction speed, making the shower one of the highest risk environments for aging adults. These are medical shower hazards that most people don't think about until a fall has already happened. Stiff joints add another challenge. Many seniors experience reduced flexibility in the knees, hips, and ankles. This limited range of motion makes stepping into or out of the shower much more difficult. Even lifting the leg a little too high or misjudging the tub's edge can cause imbalance. Arthritis and joint degeneration make it harder to bend, turn, or pivot safely. When joints don't move smoothly, weight shifts unevenly, and that uneven shift on a slippery surface creates a perfect setup for a fall. Seniors often compensate by grabbing nearby surfaces, but if those surfaces aren't designed for support, they create even more risk. Another major factor is medication. Many seniors take prescriptions that list dizziness, drowsiness, or light-headedness as side effects. Blood pressure medications, painkillers, sleep aids, and medications for anxiety or heart conditions can all affect balance and alertness. When these side effects combine with the warm steam of a shower or rapid changes in temperature, the risk increases even more. Hot water can cause blood vessels to widen, lowering blood pressure and making someone feel faint. If a senior already experiences mild dizziness from medications, the shower environment makes that sensation stronger. These medical shower hazards contribute to a large number of bathroom-related injuries every year, and most people don't realize how much medication can influence stability. Aging also changes bone density. Seniors are more prone to fractures because bones naturally become thinner and weaker with time. Even a mild fall in the shower can result in broken wrists, hips, or ribs. The combination of hard surfaces, slippery conditions, and fragile bones creates a situation where even small accidents have serious consequences. Younger adults may fall and walk away with a bruise, but seniors often experience significant injuries that require hospitalization or long recovery periods. This is what makes aging and fall risks in the bathroom so dangerous. This shower isn't just a place where falls are more likely. It's a place where falls are more harmful. Muscle mass also decreases with age, which affects strength and body control. When muscles weaken, standing for long periods or maintaining stability becomes more tiring. Seniors may become unsteady toward the end of a shower, especially when bending down to pick up soap or washing their feet. Weak leg muscles make it harder to recover from small slips. Many seniors instinctively grab the wall or soap dish to steady themselves, but these surfaces aren't designed to support body weight and often contribute to more severe falls when they fail under pressure. Vision changes also play a role. Cataracts, reduced depth perception, and low light sensitivity make it harder for seniors to judge distances, see wet areas, or step accurately. Shadows, steam, or dim lighting can distort vision, making the floor appear uneven or making the edge of the tub difficult to see. These small visual misjudgments increase the risk of losing balance, especially when combined with slower reflexes and stiff joints. When all of these factors come together, balance decline, slower reactions, stiff joints, medication side effects, weaker muscles, and fragile bones, the shower becomes one of the most high-risk places in a senior's home. Understanding these aging-related changes is the first step to reducing accidents and improving shower safety so seniors can stay confident and independent in their daily routine. Does anyone in your family struggle with balance in the shower? Comment: balance shower safety for seniors doesn't rely only on grab bars or special equipment. A big part of staying safe comes from simple habits practiced every single day. These are small routines that don't take extra effort but make a major difference in preventing slips, missteps, and sudden accidents. When these habits become part of your daily bathroom routine, showering becomes safer, more predictable, and far less stressful for both seniors and caregivers. One of the most important habits is testing the water temperature before entering the shower. Seniors are more sensitive to sudden temperature changes, and hot water can cause dizziness, light-headedness, or a sudden drop in blood pressure. By checking the temperature with a hand or wrist first, you avoid shocks that can throw off balance. Lukewarm, steady water flow is much safer than very hot or extremely cold water, and taking just a few seconds to test it greatly reduces risk. Another essential daily habit is keeping all shower essentials within comfortable reach. Many bathroom accidents happen when seniors bend down, twist, or reach too far for shampoo, soap, or towels. Every extra movement increases the chance of slipping, especially when the floor is already wet. Placing items at chest or shoulder height prevents unnecessary stretching or unstable bending. Shower caddies, corner shelves, or wall-mounted organizers make it easy to grab what you need without shifting weight or taking your eyes off the floor. This simple step alone prevents countless accidents and makes the shower feel more secure. Towels should also be placed outside the shower in a dry, easy-to-reach area. Many seniors try to step out of the tub while still wet and immediately step onto tile that's slippery from moisture. By placing a towel right next to the shower exit, you can dry off while still inside the tub or while holding onto a stable support. This minimizes the amount of water dripping onto the floor and prevents the dangerous combination of wet feet on smooth surfaces. In nuns, slip mat just outside the shower adds even more stability, but the habit of drying off before stepping out is one of the biggest improvements in a senior. Safe bathroom routine lighting is another daily habit that often gets overlooked. Bathrooms are frequently dim, and shadows from cabinets, curtains, or small light bulbs make it hard to judge distances. When steam fills the room, low lighting becomes an even bigger issue. Turning on bright overhead lights before showering ensures better visibility and reduces the chance of missteps. Seniors with vision changes benefit greatly from consistent, bright lighting that eliminates dark areas or glare. Motion sensor night lights placed in hallways or near the toilet help during nighttime bathroom trips, reducing the risk of tripping on the way to or from the shower routine. Bathroom checks are another simple but important habit. Before stepping in, take a moment to look for wet spots on the floor, loose mats, or dropped items like caps, bottles, or washcloths. These small objects create unexpected obstacles that can easily cause a fall. Checking the floor, adjusting the mat, and making sure everything is secure takes only a few seconds but significantly strengthens shower safety. Seniors who get into the habit of doing a quick scan develop a more mindful routine that prevents accidents caused by rushing or distractions. Keeping the shower area clean is also a daily habit that enhances safety. Soap residue, conditioner buildup, and body wash films become slippery over time. Even if the surface doesn't look dirty, these products leave behind a slick layer that reduces traction. Rinsing the floor after every shower helps remove residue and keeps the surface safer. Seniors who live alone or have limited mobility may not notice buildup right away, so caregivers can help maintain a clean shower floor as part of weekly upkeep. Another overlooked habit is moving slowly and deliberately when entering and exiting the shower. Seniors often fall when trying to hurry or multitask. By making each step intentional, holding stable surfaces when needed, planting each foot firmly before shifting weight, and pausing to confirm balance, you significantly reduce the risk of slipping. Slow, steady movement is safer than quick steps, especially when the floor is wet. Daily shower safety habits don't require expensive equipment or complicated routines. They're simple, consistent actions that turn a risky environment into one that feels controlled and predictable. By testing water temperature, keeping essentials close, drying off before stepping out, ensuring proper lighting, and checking the bathroom regularly, seniors build a safer foundation for their daily routine. These small habits combine to prevent bathroom accidents and help maintain confidence, independence, and peace of mind every time you shower. When doctors talk about making the shower safer for seniors, the focus isn't just on avoiding hazards, but on adding the right tools that make every movement more stable and predictable. These doctor-recommended bathroom aids are simple, effective, and proven to reduce the risk of slips, falls, and painful injuries. One of the most important additions is grab bars. They provide a strong, reliable surface to hold onto when stepping in or out of the shower, turning, or regaining balance. Unlike towel bars or shower handles, grab bars are built to support real body weight, which is critical for seniors with weaker joints or slower reflexes. They also give confidence, especially for anyone who has experienced a fall before. When installed at the right height and angle, grab bars act like an anchor that gives the body extra stability in the places where it's needed most. Anti-slip mats are another essential tool for senior shower safety. Water, shampoo, and soap create a slippery layer even on textured tile. Anti-slip mats grip both the floor and the feet, adding friction that prevents sudden sliding. These mats are designed to stay in place even when the shower floor becomes soaked, reducing one of the biggest risks for older adults. Many seniors assume that their tile is slip-resistant, but the combination of soap residue and moisture makes almost any surface hazardous. A high-quality anti-slip mat transforms the floor into a much safer space, especially for those who struggle with balance. It's one of the best senior shower safety tools because it addresses the most common cause of falls. Shower chairs offer another level of protection. Standing for long periods can be difficult for seniors with weak muscles, arthritis, or balance issues. A shower chair allows them to sit comfortably while washing, eliminating the risk of wobbling or slipping during movement. This is especially valuable when bending is required, such as washing feet or shaving. When seniors sit securely, the chances of losing balance drop dramatically. Medical grade shower chairs have non-slip legs and supportive seats that make bathing easier, safer, and less tiring. Doctors often recommend them because they take pressure off the joints and reduce the physical strain of standing in a wet environment. A handheld shower head is another simple but extremely effective modification. Fixed shower heads force seniors to twist, lean, or stretch to rinse properly, and these movements increase fall risk. A handheld shower head allows them to stay in a stable position while controlling the water flow. This prevents unnecessary bending and awkward movements. It's especially helpful for those who use a shower chair because it allows them to wash comfortably while seated. The ability to rinse harder each areas without changing body position significantly reduces the chance of losing balance. Doctor-recommended bathroom aids like handheld shower heads add convenience and safety at the same time. Non-slip footwear designed for wet surfaces is another overlooked but powerful safety tool. Regular slippers, socks, or bare feet offer little grip on smooth, wet floors. Specialized non-slip shower shoes are made with textured soles that cling to wet tile and provide stable footing even in soapy water. They reduce the likelihood of the foot sliding unexpectedly, and they create an extra layer of protection for seniors with fragile bones. These shoes also help people who have neuropathy or reduced sensation in the feet, giving them more stability and confidence in the shower. For many seniors, this small change makes the whole bathroom experience feel safer and more controlled. These doctor-recommended modifications work so well because they are designed to match the body's natural movements. Grab bars support the arms and torso during balance shifts. Anti-slip mats stabilize the feet. Shower chairs remove the strain of standing. Handheld shower heads minimize risky movements. Non-slip footwear increases traction where the body needs it most. Each tool reduces a different part of the risk, and when combined, they create a dramatically safer environment. These shower safety products give seniors independence while significantly lowering the chance of injury. Many falls are preventable with the right equipment, and these simple upgrades can make the shower one of the safest spaces in the home instead of the most dangerous. Which tool do you think every bathroom should have? Comment the name. Creating a safe shower routine for seniors is one of the most effective ways to prevent falls because it turns a risky environment into a predictable, controlled process. A fall-proof bathing method isn't about rushing or working harder. It's about moving slowly, using support when needed, and following steps that keep the body balanced and stable from the moment you enter the bathroom to the moment you walk out. Doctors often emphasize this because many accidents happen not from major mistakes, but from small, unnoticed habits that can easily be replaced with safer ones. A doctor-approved senior hygiene routine starts before stepping into the shower at all. The routine begins by preparing the space. Make sure the bathroom is brightly lit and the floor outside the shower is completely dry. Place a non-slip mat right at the entrance so you have firm footing the moment you step out later. Keep a towel within reach, but not in a place where you have to stretch for it. If you use non-slip shower footwear, put it on before entering. These small steps set up the environment for a safe start before entering. Test the water temperature with your hand or wrist. Sudden heat can cause dizziness, while cold shocks can throw off your balance. Setting the water to a comfortable, steady temperature helps prevent light-headedness once you're inside. When you're ready to step in, hold onto a grab bar with one hand and move slowly. Plant one foot securely on the anti-slip mat inside the shower before shifting your weight. Many seniors fall because they try to enter too quickly or without a stable point of support. Using grab bars at the entry is one of the most effective parts of a safe shower routine for seniors once inside. Take a moment to find your balance before doing anything else. Let your body adjust to the temperature and steam. If you use a shower chair, Sit down right away rather than standing for long periods. Sitting reduces strain on the knees, hips, and lower back and keeps you steady while washing. If you prefer to stand, keep both feet firmly planted on the anti-slip mat and avoid sudden turns or quick movements when washing. Avoid bending over or twisting. These motions shift your center of gravity and increase the risk of falling. Instead, use a long-handled sponge or brush to wash your legs, feet, and back. These tools let you clean effectively without reaching or stretching. Keep shampoo, soap, and other essentials at shoulder or chest height so you don't need to bend down or reach up. This is one of the most important steps in a fall-proof bathing method because most shower slips happen during bending movements. A handheld shower head makes the process much easier by allowing you to rinse without twisting your body. Hold it close to your body, move slowly, and keep water aimed downward to avoid creating slippery pools around your feet. Take your time. Moving slowly in the shower is safer than rushing. Seniors often feel tired faster because of medication, joint pain, or muscle weakness, so pacing yourself prevents fatigue that can lead to unsteady steps. If you start to feel light-headed, place one hand on a grab bar and pause until the feeling passes. Dizziness is common in warm, humid environments, especially for seniors taking blood pressure or heart medications, so timing your routine is important. Avoid showering right after waking up, after a large meal, or immediately after taking medication that may cause drowsiness. Choose a time of day when you feel strongest and most alert when you're ready to exit. Hold the grab bar firmly and step out 1 foot at a time onto the dry non-slip mat outside the shower. Make sure your feet are as dry as possible before stepping onto regular flooring. Using a towel while still inside the shower or while holding a grab bar gives you far more stability than trying to dry off on the open floor. Once you're fully out, take a moment to regain your balance before walking away. A safe shower routine for seniors doesn't end when the water stops. It ends when you are fully stable and dry following this step-by-step routine helps create a calm, predictable process that dramatically reduces the chance of slipping. When seniors move slowly, use support tools wisely, avoid bending, and choose the right time to shower, the risk of falling drops significantly. These simple modifications turn showering into a secure, comfortable daily habit instead of a dangerous one. Should I create a printable safety checklist next? Comment checklist. Maintaining a permanently safe bathroom environment for seniors requires more than just adding tools or following a daily routine. Long-term senior safety depends on ongoing awareness, regular maintenance, and thoughtful adjustments that anticipate the challenges aging brings. Many falls happen not because of a single hazard, but because small problems accumulate over time. Regular checks on flooring, mats, and grab bars are one of the most effective ways to prevent bathroom injuries. Anti-slip mats can lose traction after months of use, and grab bars can loosen slightly from wall stress. Inspecting these items weekly, tightening screws, replacing worn mats, and ensuring every surface is stable keeps the shower and bathroom consistently safe. Hydration and blood pressure stability are critical but often overlooked elements of long-term safety. Seniors who are dehydrated or have fluctuating blood pressure are more prone to dizziness and fainting in the shower. Drinking a glass of water before bathing and allowing time for medication adjustments or blood pressure stabilization can make a major difference. This simple step reduces the chance of sudden light-headedness, helping seniors maintain balance throughout the entire shower routine. Combining physical modifications with healthy pre-shower habits strengthens overall home safety for seniors' bathroom layout. Adjustments also contribute to lasting security. Removing unnecessary obstacles, placing essential items at reachable heights, and organizing the shower area so movement is minimal reduces risks every day. Items like loose stools, laundry baskets, or decorative objects can create unexpected tripping hazards. Reconfiguring the space to allow clear pathways, installing corner shelves for essentials, and ensuring adequate space to maneuver a shower chair or caregiver if needed creates a safer, more accessible environment. Even small adjustments in layout can dramatically improve long-term safety. Considering caregiver or family support is an important part of a preventive plan. Some seniors may be able to manage independently, while others benefit from having someone nearby to assist, especially if they have balance issues, cognitive challenges, or complex medical conditions. Support doesn't have to mean full-time supervision. Even periodic check-ins, helping with routine maintenance, or assisting with shower setup provides reassurance and reduces risk. This approach ensures that seniors feel independent but still have backup when needed, which is a key principle in long-term safety planning. Regularly updating and maintaining safety tools also matters. Grab bars, shower chairs, anti-slip mats, and handheld shower heads wear down over time. Replacing worn items, choosing higher quality materials, and checking installation regularly are simple ways to ensure the environment remains secure. These small steps prevent equipment failure. One of the silent contributors to bathroom falls, creating a culture of mindful habits alongside environmental improvements, is equally important. Encourage seniors to move slowly, plan their shower routines, and maintain awareness of temperature and footing. Reinforce good practices like drying off before stepping out, sitting when needed, and using grab bars consistently. Long-term senior safety isn't a one-time effort. It's the combination of reliable tools, maintained infrastructure, personal habits, and occasional support. By combining these strategies, regular maintenance, hydration, careful layout planning, and appropriate support, families and caregivers can ensure that seniors enjoy a safe, independent, and predictable bathroom routine. The goal is to prevent accidents before they happen, reduce anxiety about showering, and maintain confidence and quality of life over time. When these long-term preventive strategies are in place, seniors can shower comfortably and safely every day, creating peace of mind for both themselves and their loved ones. Do you want a full home safety series for seniors? Comment yes, safety.